I might give it about 60 more seconds before we get started to see if anybody else is logging in. So let's give it one more minute and then we'll go ahead and get started and get this last part of the Medicare series done for you. So I'll be back in about 60 seconds. Thanks. All right. Well, I think that's going to be long enough, so we'll go ahead and get started. So good evening. Thank you for joining us again tonight for part 4 of the 4-part series, Medicare 101. Tonight, we're going to be talking about other health insurance options to go with Medicare. This is part 4 of 4. A couple of quick items before we get started. If you have questions, I will be pausing throughout the presentation to see if there are questions that people have. If you have a question, you're welcome to simply unmute when I pause for questions and ask your question, or you're welcome to type your question into the chat box at any time, and I will address any of those questions at the pauses. Hopefully everybody got the email that I sent out about an hour ago, or maybe half an hour ago, that included the handouts and the slides for tonight's presentation so that you can have that information and follow along if you choose. And I think that's it. So let's get started. All right. So Medicare 101, Part 4, Medicare and other health insurance options. My name is Roma. I'm with the Area Agency on Aging and the Pikes Peak Area Council of Governments, and I am the coordinator for the SHIP program. The Area Agency on Aging's mission is to work with other communities within our 3-county area to develop systems that allow people to stay in their homes for as long as possible, to stay in the community for as long as possible. This Medicare 101 4-part series is in partnership with the Pikes Peak Library District. We've partnered with them for several years now, and it's been a very successful partnership. Pikes Peak Library District has many wonderful programs, and we are very happy and pleased that they are willing to partner with us after all these years. And hopefully that will continue for many years to come. Again, I am the coordinator for the local SHIP office, the State Health Insurance Assistance Program, which is a federally funded program that provides information and education and assistance on all things Medicare to every county in every state of the country. This is a free service. We don't sell or endorse any specific insurance products or companies. We provide education and one-on-one assistance in all things related to Medicare. On the slide, I have included our local Colorado Springs number and our statewide toll-free number. This SHIP office in Colorado Springs actually serves 9 counties of Colorado. A quick review of the topics we've covered already in the previous weeks. The first week we talked about eligibility, enrollment, and the different benefits of Medicare Part A and Part B, also known as Original Medicare. The second week we talked about the specifics of the different kinds of insurance options that you can purchase, such as a Medigap or Medicare Supplement or Medicare Advantage plans. And then last week we went into detail about Medicare Part D, the prescription drug benefit. Tonight, we're going to wrap it up with other options that might be available to you with Medicare, including active employer group coverage and even Cobra, retiree coverage through an employer, coverage available for retired and active military. We're going to talk about Medicaid, and we're going to talk about the marketplace, the Affordable Care Act benefits. So let's get started. So many people who become eligible for Medicare by turning 65 may still be actively employed or may be covered by their spouse's active employer group coverage. If you are actively employed with an employer that has 20 or more employees, and you have health insurance through that employer, and that health insurance covers you and or your spouse and or your dependents, you may be able to delay enrollment into Medicare in favor of that employer group coverage. If you're able to delay enrollment and you choose to delay enrollment in Medicare based on the fact that you're still actively employed with employer group coverage, when you choose to stop working, or you are laid off or you retire, whatever the situation is, when you lose that active employer group health coverage because you're no longer actively employed, you would be allowed to enroll in Medicare during a special enrollment period. That special enrollment period is a total of 8 months from the time the employer coverage and active employment end, to enroll in Medicare without penalty, regardless of when that happens during the year. On the other side of that coin, if you are actively employed, your employer cannot require you, encourage you, suggest to you that you need to enroll in Medicare. They are also not allowed to pay for Medicare for you to get you to enroll. As long as you are actively employed and you are eligible for the employer benefits, Medicare is irrelevant. They have to continue to insure you as if Medicare didn't exist for you or was not an option for you, no matter what. But keep in mind that if you choose to delay enrollment in Medicare because you're still actively working or covered by a spouse's active work employer coverage, you do get an extended amount of time to enroll in Medicare when that employment ends without penalty. For many people, and especially this past year has been a good example of that, for people who have been actively employed, but perhaps lost that employment or lost their status of employment that qualified for health benefits, you may have qualified for Cobra Coverage. Cobra Coverage, Cobra stands for the Consolidated Omnibus Budget Reconciliation Act. I can't even pronounce it tonight. This is coverage that is federally mandated to be offered to employees when either that employment ends or there's been a situation where you no longer qualify for the employer coverage due to reduction of work hours or something like that. Cobra Coverage is basically just a continuation of the health benefits that you had while you were actively employed beyond employment. Cobra Coverage is available to people regardless of their age, typically. But for people who are becoming eligible for Medicare, you do have to be careful about if you take advantage of Cobra and are eligible for Medicare. Regardless of what your status is with Medicare, if you have dependents such as a spouse or dependent children that you have been covering through your employer coverage, and that employer coverage ends, you would be able to get them on Cobra so that they have continuation of coverage, regardless of whether or not you'd be entitled to Cobra, because they would still be entitled as your spouse or dependent. The reasons you might not be entitled to Cobra in this situation is if you were eligible for Medicare at the same time you are no longer actively working. Whether or not you are eligible for Medicare is dependent on when Medicare, or whenever you're eligible from Cobra is dependent on when your Medicare eligibility is. So if you were actively employed, you became eligible for Medicare and or enrolled in Medicare Part A, and then lost employment coverage, you would be able to enroll in Cobra. You, your spouse, your dependent children would be able to enroll in Cobra. If you were actively employed, lost that employer coverage and not eligible for Medicare yet, you would be able to enroll in Cobra. But as soon as you became eligible for Medicare, you would want to enroll in Medicare because you would no longer be eligible for Cobra once Medicare entitlement came into effect. Even if that happened to you, your dependent spouse and children would still be able to continue with the Cobra coverage for as long as it lasted. And Cobra coverage is a temporary coverage designed to be a temporary coverage and typically only lasts about 18 months. So again, if you're entitled to Medicare prior to employment ending, you would be allowed to enroll in Cobra in addition to spouses or dependents. But you would want to keep in mind that Cobra is not active employment coverage. And the only reason you can delay enrollment into Medicare A and B is if you are actively employed with employer coverage. So Cobra would not be considered a credible reason to delay enrollment into Medicare once that employment ends. So you would still have to take advantage of that 8-month special enrollment window when your employment ends to enroll in Medicare without penalty. You would not want to use the Cobra for the full 18-month window, because that would put you beyond your 8-month window of special enrollment into Medicare. And again, if you do enroll in Cobra because you have not yet become eligible for Medicare, as soon as you become eligible for Medicare, you should no longer be eligible for Cobra. And you would want to enroll in Medicare when you needed to, as soon as you are able to be effective when you are initially eligible. Again, your spouse dependents could stay on Cobra, but you would want to drop Cobra or have to drop Cobra in favor of Medicare. Cobra can be very, very confusing and very complex. And I would always encourage you to talk to your human resources department about any specific questions you have about eligibility, because there are all kinds of exceptions and extended abilities to get the coverage to last longer. So Cobra can be complex. So if there's any specific questions or concerns you have about it, I do strongly encourage you to talk to your human resources department at the employer, or you are welcome to contact us, the local SHIP office, and we will help you as best we can. Any questions about any of that so far? I'm not hearing any, I'm not seeing any, so we will move on. Again, Cobra laws and rules are complex and confusing. Please talk to somebody if you have questions. So now let's talk about retirement coverage through a past employer. So if you have an employer that you are retiring from and that employer is going to offer healthcare benefits as a retirement benefit, that's wonderful. I would certainly strongly encourage you to look into those options to see if they are going to be cost effective, to see if they are going to be comprehensive enough and coordinate with your Medicare to make it worth the while to have them. But keep in mind that employer retirement benefits can vary significantly from employer to employer. Even if benefits are designed to coordinate with your Medicare, once Medicare goes into effect, they can still be significantly different from employer to employer, because employers that offer retirement health benefits for their retirees can basically customize their options that they offer. And I have seen employers customize options so significantly that they don't resemble anything that we've talked about so far. And that's usually a good thing. And I've seen employers simply do nothing and hire a third-party contractor to basically get you enrolled in something that they will help pay for, something that's already standardized and on the market, and they will simply help pay for that. So it's always a good idea to talk to HR to be sure you understand what benefits are being offered and how those benefits work with and without Medicare, what those benefits are going to cost you, if anything, and how those benefits, how good are those benefits. You'd also want to make sure that whatever benefits are being offered from your employer, past employer, includes creditable drug coverage or drug coverage at all. Some employers these days simply, again, hire that third-party administrator to help you get enrolled in a Part D plan, and they will help cover some of that cost. Other employers may specifically design a health benefit specifically for their employees that is customized to the point where it may or may not be good coverage, and it may or may not include creditable drug coverage for that purpose. You'd also want to strongly consider how much your cost would be to have that employer retirement benefit versus what your cost might be to purchase a supplement or enroll in a Medicare Advantage plan or Part D plan on the regular market, and whether or not those benefits are truly going to coordinate or pay anything after Medicare pays their part first. Again, would strongly encourage you to talk to your human resources department about what benefits are being offered, what their costs are, and how that coverage works with or without Medicare. Some employers may also just offer subsidies or lump sum deposits that will help cover the cost of Medicare premiums or other health insurance premiums to go with Medicare that you can either get reimbursed from at the end of the year, or you can use on a month-to-month basis to pay those premiums. So it really can vary significantly from employer to employer. Again, be sure to take into consideration all of the costs, all of the coverage, and how it coordinates with or without Medicare. Ease of use is another thing to take into consideration. If you are not used to enrolling in an HMO or being enrolled in an HMO, but that's what the employer is offering retirees, that might be something to consider because you're not used to that kind of health coverage and having to stay within a network, whatever. The more you understand, the better decision you'll be able to make in that regards. I know I talk to a lot of PERA retirees. I talk to a lot of federal civil service retirees that get coverage through the Federal Employees Health Benefit System. I talk to a lot of military retirees. And all of those types of retiree benefits are significantly different from the other, and the costs are significantly different. Any questions about retiree coverage? Again, if you have a question, you can simply unmute and ask your questions, or you're always welcome to type it into the chat box. All right, I'm not seeing any, I'm not hearing any, so we will move on. As I just mentioned, I do talk to a lot of retired military because obviously in Colorado Springs, we have a lot of retired military. For those who are retired military, meaning you've put in your 20 or more years into the service and have been honorably discharged, typically, unless you have gone back to work in the private sector and have employer health coverage in that private job, many retirees could still be covered under TriCare, standard or prime, which is the same coverage they had prior to retirement. Regardless, if you are retired military, whether you are actively employed in the private sector or not, once you become eligible for Medicare, you are going to have to make some decisions. If you are actively employed through the private sector and have employer group coverage, again, you can delay enrollment into Medicare and wait until you decide to stop being actively employed. Once you are no longer actively employed, you enroll in Medicare. As soon as you enroll in Medicare, you would want to enroll in TriCare For Life or TriCare Coverage so that you get TriCare For Life. If you are not actively employed with employer group coverage through your own employment or your spouse's, and you are still using TriCare coverage, as soon as you become eligible for Medicare, you're going to want to enroll in Medicare so that that TriCare standard or prime turns into TriCare For Life and coordinates with Medicare. The DEERS offices here locally do seem to be pretty good at sending reminders through the mail to those retirees who are approaching Medicare a couple of 3 months prior to Medicare effective date to remind you that if you are using TriCare, you need to contact the DEERS office, let them know that you are enrolling in Medicare so that you can continue that TriCare coverage in any form or fashion. If you enroll in Medicare, you are eligible for TriCare For Life and you get the TriCare For Life, I can tell you without question that you probably have, between Medicare and TriCare For Life, the best medical coverage available in this country today. You do not need to enroll in anything else. You do not need to enroll in a drug plan, Part D. You do not need a supplement. You do not need an Advantage plan. Between Medicare and TriCare For Life, you basically have 100% medical coverage. and really good pharmacy benefits at no extra cost. If for some reason you are considering enrolling in something in addition to TriCare, keep in mind that if you do that, TriCare becomes the payer of last resort, and whatever other health benefits you have would be the primary payer, the primary processor of claims, and TriCare may or may not pick up any balances that might still be left over if you enroll in other coverages. But the bottom line is you shouldn't need to enroll, you don't have to enroll, and you shouldn't need to have any additional coverage. I also talked to a lot of veterans who access the VA system. So veterans would be considered not retired military, but did serve honorably during a time of conflict and qualify to use VA services. There are eligibilities that you have to meet in order to use VA services, and that could be based on income or disability or medical need. But if approved, it allows you to use the VA medical facilities, the services, the pharmacy. If you are a veteran and you access the VA system, be aware that if you access the VA pharmacy is considered creditable, so that you would not be required or need to enroll in a Medicare Part D plan. So you would be able to use the VA pharmacy instead of having a Medicare Part D. If you chose to enroll in a Medicare Part D, you would also be allowed to do that. So you could have both VA and Part D coverage. Depending on what your needs are, some people tend to do that. But also be aware that VA services are not considered health coverage. So VA medical system is not considered an insurance benefit or a health benefit, health coverage. And so it's not an acceptable reason for not enrolling in Medicare when you first become eligible. I get a lot of veterans ask if they need to enroll in Medicare Part B if they use the VA for everything. And my answer is always probably. The VA system can work very well for a lot of people. However, that doesn't necessarily mean that having Medicare is not going to be a good idea. Because when you use the VA system will take care of you for VA-related services. Whereas Medicare is good anywhere for any reason at any time, period. So if you have Medicare, you're able to go to any medical facility for any reason whatsoever, anywhere in this country. You don't have to worry about being close to a VA facility or going through that process. You can use any provider that takes Medicare for whatever you need, whether it's VA related or not. The VA system will take care of you for VA related services. The other thing to be aware of is that VA and Medicare do not coordinate with one another. One is not secondary to the other. You use VA system for VA services, use Medicare for anything you want, but they will not coordinate with one another. They will not pay the balance left over from one to the other. You can use both and you can have both, and it's usually a good idea to have both, but they do not work with each other. They're totally separate. And then, of course, the other benefit to VA services could be access to long-term care services and supports for people who have some more complex needs. I did provide websites at the bottom of each of these slides so that you can go and find more information if you like. Any questions about VA system or retired military system? Oh, I have a question in the chat box, so let me look at that. So I do have a question in the chat. Says, if you are employed at age 65 and have coverage through work, do you have to notify Medicare that you're going to delay enrollment? That's a good question, actually, because I get a lot of people who have tried to call Social Security and tell them that they are going to not enroll in Medicare because they're working. And quite frankly, Social Security doesn't have a process for you to do that. When Social Security used to automatically enroll people in Medicare when they turned 65, that was different. You'd have to call them if you were still working to tell them, no, I don't want my Medicare, I'm still working. Social Security stopped automatically enrolling people when they turn 65 if they're not collecting Social Security. So it becomes your responsibility to tell Social Security that you didn't enroll in Medicare because you were working, but to tell them in advance, to tell them that's why you're not going to enroll in Medicare, you don't have to do that. And honestly, they don't have a way to record that or a process for you to do that. All you have to remember to do is when you stop working, you need to realize that you will have to prove that you had been employed with employer group coverage to Social Security so that they don't try and penalize you when you go to enroll in Medicare. That process is simply a form, and a Social Security form that your employer fills out that says so-and-so employee was working here from this date to this date. They had health coverage from this date to this date. And that's it. If for some reason the employer does not or cannot complete that form for you, and usually when they complete it, they send it to Social Security for you as well. If for some reason the employer is unable to do that, you can fill it out yourself and self-attest that you had coverage from this date to this date, and then Social Security will follow up on it. But yeah, you do not have to inform Social Security, and probably there's no purpose of trying to inform Social Security that you are going to delay enrollment into Medicare in favor of work, because they simply don't have the ability to process that information. So hopefully that answers that question. Any other questions before we move on? Okay. So the next thing we're going to talk about is Medicaid. This can be a pretty hot topic right now, because there are many people, because of the Affordable Care Act, who were able to get health insurance through the Medicaid system based on the Affordable Care Act and expanded Medicaid benefits. And Colorado was actually one of the states that was ahead of the game to get that whole system set up and get people encouraged to enroll in Medicaid if they qualify. Because of the COVID pandemic, people who have been on Medicaid prior to turning 65, for whatever reason, have been given extended eligibility and coverage through Medicaid based solely on the COVID pandemic. What that means is those people have not been able to get out of Medicaid. They were basically kind of forced to stay in Medicaid because of the pandemic. And the whole purpose of that is so that the government is making sure that you have health coverage if you need it. I mean, it's not supposed to be a bad thing. It's supposed to make sure that no matter what happens, no matter why, you have health coverage if you need it. However, once someone becomes eligible for Medicare, they're typically no longer eligible for that kind of Medicaid. These people have been continuing on that Medicaid, even though they've been eligible for Medicare. And that will continue. Their Medicare will stay in place until the pandemic ends. Regardless of the Medicaid status, if you become eligible for Medicare, you need to enroll in Medicare. The forced Medicaid or the forced pass Medicaid is not going to be considered a credible reason to not enroll in Medicare. And Medicare at this point has not suggested in any way, shape, or form that they will allow a special enrollment opportunity for people who didn't enroll in Medicare due to being forced onto Medicaid or stay on Medicaid in this situation. So if you've become eligible for Medicare, or you are going to become eligible for Medicare in the future, and you have Medicaid now, you need to remember to enroll in Medicare as soon as you are eligible. Even if Medicaid stays in place, you need to enroll in Medicare. When Medicaid ends, you will have special enrollment periods into other coverage, such as the supplements and the Medicaps and the Part Ds and the Advantage plans. But again, it's not going to be considered a credible reason to not enroll in Medicare at that time. And there will not be a special enrollment into Medicare for people who delayed enrollment into Medicare based on the Medicaid. So with that out of the way, I also want to let you know that there are lots of kinds of Medicaid out there. In Colorado specifically, we have about 40 different kinds of Medicaid. Each level of Medicaid or category of Medicaid has different eligibility criteria, different income and asset criteria, different needs criteria. Most of those programs are going to be geared towards people under 65, because in Colorado, once you become eligible for Medicare at 65, your eligibility for Medicaid changes. And you become eligible for fewer programs because now you are eligible for Medicare. And Colorado is probably one of the more generous states when it comes to the different types of Medicaid that are available. But all Medicaid programs vary from state to state. Some states have more options, some states have fewer. States can have different eligibility criteria, different income and asset limit criteria to qualify. And then if you do qualify for Medicaid under any circumstance, always remember that Medicaid is the payer of last resort. So if you qualify for Medicaid, but you are also covered by, a parent's employer coverage or a spouse's employer coverage, you can have both if you qualify for both, but Medicaid would always be the payer of last resort, meaning the employer coverage would pay claims first, and if there's any balance left over, Medicaid may or may not pick up some of that tab. Question in the chat box: does Colorado Medicaid for long-term care cover in whole or in part charges for companion care, skilled or unskilled? That's a good question. Again, many different kinds of Medicaid. Long-term care is one of the most common Medicaid uses or programs used. Unfortunately, Medicaid, as generous as it is, and for as many services as it will pay for that Medicare does not cover, companion services are not one of them. Medicaid will pay for homemaker care, homemaker services and personal care, which Medicare does not, but specifically companion services, no, it does not. Now, if it's homemaker service, so you have someone coming in to help with keeping the house cleaned up and, helping maybe prepare meals, coming in for personal care to help someone get in and out of the shower, or get dressed in the morning. If that particular worker is also considered a companion for that person, that's fine. But if that person is there just for companionship, no, that is not covered. But if companionship is part of a service that is covered, that's different. So it's kind of a gray area, but if it's specifically just companionship service, no, not covered by any insurance that I'm aware of. So hopefully that answers that question. All right. And we are almost done. So Medicaid programs that typically apply more specifically to people with Medicare are going to be Medicare savings programs, which we talked about briefly a couple of weeks in a row. These are programs that are for people who are on Medicare, have limited or low income and asset limits. And these programs are designed to help cover the costs of Medicare. So they will help pay the Medicare Part B premium, and they could potentially help cover any balance that Medicare left over or any deductibles for Part A and Part B services. Other programs for people who have even more limited or low income. There are cash programs available, such as OAP, which stands for Old Age Pension, which is a horrible name for a program, but so OAP can provide a cash benefit, a monetary benefit every month, or SSI, which is supplemental security income, which comes directly and is applied for directly through Social Security and can supplement maybe retirement Social Security benefits. If someone is eligible for either of those programs, the cash benefits, you automatically are eligible for full Medicaid benefits to go with Medicare regardless. If you need long-term care assistance, whether that's home and community-based services where care comes to you in your home, or if it's services you receive while you are in assisted living or in a nursing facility. Long-term care Medicaid can cover the cost of room and board, as well as come with full Medicaid benefits for most people who have Medicare. And the email that I sent earlier, it does include a handout that briefly describes some of the eligibility requirements. Anybody who applies for any of those programs and is approved automatically also gets assistance with drug coverage, the Part D, so that they have little or no cost for their pharmacy needs. And then if anybody has any additional questions or wants to go over any other eligibility criteria or anything like that, we are more than happy to talk to you about Medicaid. We do help with Medicaid applications at our office, and we can certainly help you better understand what benefits may or may not be available to you. Any other questions about the Medicaid? Okay, so we're going to get done quick tonight. So the last thing we're going to talk about tonight is marketplace coverage, also sometimes referred to as Obamacare. This is the part of the Affordable Care Act that allowed people who had pre-existing health concerns to buy insurance. Prior to the Affordable Care Act, if you did not have insurance through an employer, you did not qualify for Medicaid for some reason, and you had a pre-existing health concern, you were basically uninsurable. Nobody was going to insure you. Nobody was going to sell you anything. But the Affordable Care Act, the purpose of that law was to make sure that people had the opportunity to be insured, regardless of their situation. In Colorado, we chose to manage our own marketplace for this kind of health insurance coverage. So for people who are maybe self-employed, for people who are not eligible for Medicare for whatever reason, for people who are in between jobs, perhaps, they are able to go to the marketplace and buy health coverage at, private health insurance with guarantee issue. Basically, they cannot be turned down regardless of any pre-existing health issues. Colorado chose to manage their own marketplace, so that may or may not be a good thing compared to other states, but it does keep our market a little fuller, and perhaps it, encourages a little more competition between the insurance carriers. Colorado marketplace coverage does have annual enrollment opportunity. So just like with most Medicare options, you have a once a year opportunity to get into, get out of, or change from one kind of coverage to another. Their enrollment opportunity is going on now. As well, it kind of coincides with the Medicare open enrollment, but theirs extends, I think it's going to be extended through March of next year. And to enroll in this kind of coverage, you would go to connectforhealthco.com, or you can call their customer service number. It is private insurance, basically. And so you'd want to be sure to look carefully at the costs of this kind of coverage. If you qualify based on income, you may qualify to get tax credits or premium subsidies that could significantly reduce your monthly cost for that kind of coverage, but would be something that you'd have to make up at tax time. For people who are eligible for Medicare, typically you're not going to be eligible for marketplace coverage, with some exceptions. So if you are eligible for Medicare, but you're not eligible for premium free Part A, meaning you did not have enough work history to qualify for free Part A, you could purchase marketplace coverage instead because you don't qualify for free Part A. So if you chose to enroll in marketplace coverage instead of paying the premium for Part A and Part B together, you could do that. If you are already enrolled in Medicare A and B, or even just Medicare Part A, you are not allowed to enroll in marketplace coverage, and it would be illegal for someone to enroll you in a marketplace plan, period. You cannot enroll in marketplace instead of Medicare, again, unless you are not enrolled in Medicare and are not collecting Social Security income. Again, you would be able to enroll if you pay for Part A, but if you're eligible for free Part A, you are not going to be able to enroll in marketplace or have marketplace. And currently, there is no rule that says that staying in the marketplace because you didn't know you should have enrolled in Medicare is not going to be a credible reason for late enrollment into Medicare, because again, it's not active employer coverage. So most people who are eligible for Medicare, whether you enroll or not, typically should not be enrolled in marketplace coverage. If you have marketplace coverage and you become eligible for Medicare, you're going to want to contact your current marketplace insurer, let them know Medicare is going to be starting whenever it starts, and they will make sure to stop that coverage when Medicare starts. So you would simply move on with Medicare from that point. If you are a couple and one person is becoming eligible for Medicare, but the other person is not, the person who is not becoming eligible for Medicare would be allowed to stay on the marketplace coverage, and it would certainly reduce the premium for the two. If you have Medicare, you would be eligible to shop for dental coverage or dental vision coverage through the marketplace. And that's because those are benefits that are not covered by Medicare. So if you are looking for comprehensive dental insurance, you can go onto the marketplace and shop for that kind of insurance, even if you have Medicare, because Medicare does not pay for dental or cover dental. You can shop for that kind of coverage wherever you want. The marketplace would be one option, but I know many, many, many more insurers have gotten back into the dental insurance market in the last couple of years alone. So if you have insurance through other companies, such as your home insurance, or if you have Medicare and you have a Medicare supplement, you can ask your supplement insurer if they have dental benefits that they can sell. You can open the yellow book, the phone book, and look up dental insurance insurers in the phone book. You can purchase that kind of coverage wherever you want, again, because it's not a benefit of Medicare. And it would be worthwhile to shop the marketplace if you're shopping around. And again, marketplace rules can be a little complex and confusing. I did include a handout with some frequently asked questions about marketplace coverage and Medicare with the email that I sent out earlier. And again, if you do have any additional questions, you are welcome to give us a call, and we're happy to look at your specific situation and try and get you the answers that you need. And that is all I have for you tonight. Again, we are your local SHIP office. We are your local Medicare experts. Our office currently has 5 full-time counselors and 1 part-time volunteer counselor. We are right smack dab in the middle of annual open enrollment for Medicare. So we are a little busier. Actually, no, we're significantly busier than we usually are. But we are always happy to talk to you. We are not seeing people in person at this time, but you're welcome to shoot me an email and I will get back with you. You can give us a call and a counselor will call you back as quickly as we can. We are open to doing Zoom appointments. We are open to doing telephone appointments, whatever works best for you. So again, if you have questions, give us a call, shoot us an email, and we will get back to you as quick as we can. So let's see if there are any other questions. Because we did get done a little early, I am more than happy to take questions about any part of our 4-week discussion that we've had so far. So if you have any questions related to any of the other 3 parts of the series that we've already discussed, I'm happy to address any questions at this time while we still have a few minutes. If you were unable to attend some of the previous sessions, please remember that All of these sessions are recorded and they are posted on our website. And you would be able to go to our website and view them at your convenience in the comfort of your own home, of course, as well as the handouts are posted and available to download. So if you missed a session, if you were not able to find out about this 4-part series until it was over, then you are always welcome to go to our website and view these pre-recorded sessions. Again, if you have questions, we're happy to talk to you. Give us a call, shoot me an email. Otherwise, I am going to let you guys go. If I don't see any questions or hear any questions, let you guys go, watch football or whatever else you want to do tonight. Again, we do greatly appreciate you attending our series. Hopefully you found it educational and useful. We will be restarting this 4-part series for anybody who wants to attend or recommend it to a friend or family member, again in February. But keep in mind that there are always pre-recorded sessions people can watch at their convenience. So if I hear no other takers, I'm going to say thank you again and good night. Give us a call if you need us.